Joining us are Dr. Maria van Kerkhove, who is Interim Director for Epidemic and Pandemic Threats Management. And we also have from our regional office in the Africas, Dr. Otim Patrick Ramadan, who manages a lot of our acute emergency events in the African region. So thank you to these experts for joining us to answer your questions. I'm Shagun Khare. I work with the WHO's Communications Department, and I'll be taking your questions to our experts. I'm going to be looking a bit onto the side where I'm receiving the questions that are coming in. But just to get the conversation started, I'm going to ask Dr. Patrick. Dr. Patrick, what is Mpox that we're talking about today? What is this disease and who is affected by it?
Thank you very much, Shagun, for the question, and good morning to all the viewers. I would like to really start by laying the foundation on what Mpox is. So Mpox, as we know it, is an infectious disease. It's caused by the virus, and the virus is known as the monkeypox virus. Now, it's usually characterized by three major symptoms. There are many, but the major ones I would like to state is that it's characterized by fever, and then we have swelling of lymph nodes. The lymph nodes are usually found in your neck, in the axilla or the armpit, and then around the groins. But then it's also followed by lesions. So lesions in the mouth, in other mucosas, and the skin rash, which starts on the face and then can spread to other parts of the body, including the palms of of your hand and the soles of the foot. It usually most people recover, but some people do develop severe disease, and then a few people unfortunately die from the disease as well, those who develop complications. Now, your second question was on who is affected. Yes, so let me also talk about that. So any person can get Mpox. So Mpox can affect anybody. Now, currently in the African region, we have outbreak active in 13 countries. And then in these 13 countries, we are seeing a wide range of people being affected. We are seeing transmission at household level affecting children, but we are seeing also adults that are affected as well.
Thank you, Dr. Patrick. I'll ask Dr. Van Kerkhove. One of the things that Patrick mentioned was that few people will get severe disease. Who are those people? Or, what are the risk factors that make Mpox worse for some people? Can you describe a bit who's most at risk?
So thanks, Shagun, and it's a pleasure to be here today with Dr. Patrick as well, talking about this important disease. So who's most at risk is different than it's not the same thing as who may develop severe disease. So in terms of who is most at risk, these are individuals who are coming in contact with someone who has Mpox, mainly when they have lesions, mainly when they are symptomatic. But there's a lot that we're really learning about this virus. There was a lot learned during the 2022-2023 global outbreak, which was driven by the clade 2 virus. I'm sure we'll come to that in a bit, brought largely under control by changes in behavior, really in the changes in the contact patterns that people had. But mainly what we know about the transmission is that it's people who come in close contact, maybe skin to skin contact with people who are infectious with Mpox. There's other modes of transmission that we're learning about. And with this upsurge of Mpox, largely due to a different clade 1b, again, we'll come to that in a bit, there are different modes of transmission. We've seen transmission in households, affecting younger people. We've seen transmission in sexual networks, mainly affecting adults. But we need to better understand what's happening in the Democratic Republic of the Congo, in Burundi, in other countries where we're starting to see that upsurge. In terms of severe disease, what we know, and again, we're still learning about this, it's mainly people who have underlying conditions. Immunocompromised individuals, if they're infected with the Mpox virus, may have worse outcomes. And this is really important that in HIV populations, in populations that are immunosuppressed, that if the virus is circulating near you, if you're in contact with someone with Mpox, what you can do to prevent yourself from getting infected, and where you can seek care through your medical care providers.
Thank you, Maria. I'd like to remind our viewers that you can join us on X, on Facebook, on LinkedIn, and YouTube, and you can send in your questions to our two experts here using the hashtag AskWHO. So please, ask whatever you want to know about this disease and what's going on. So we've heard a little bit about the disease. I'll go to Patrick to ask him about what the current situation is. What is it that's happening right now that has us concerned?
Thank you very much, Shogun. So yes, as I mentioned earlier, so within the African region, we have 13 countries this year that have reported confirmed Mpox cases. Currently, we have active outbreak. When we say we have active outbreak, we mean that at least in the last 42 days, the country has confirmed at least one case. So we have 11 countries that have active outbreaks at the moment. Now, when you look at these countries, it's not the same. Out of these, it's actually only 2 countries that have reported more than 50 cases this year. That is DRC, which accounts for over 90% of the 3,500 confirmed cases that we have had, and then Burundi, which has outbreak that started in July, around July 25th, and now they have reported 170 cases. So those are the most affected countries that we say for the moment that they have established community, increasing community transmission. But we have then concerns, like Maria had mentioned, that we have seen outbreak in countries that had not had Mpox before, and those are countries that are neighboring DRC, where we have seen an extension of the clade 1B transmission that was happening in the eastern DRC into Uganda, Rwanda, Burundi, and Kenya. But I must also clarify that for Uganda, Kenya, and Rwanda, we have had very few cases. Uganda 3 cases, Burundi, Rwanda 4 cases, and Kenya only 1 case. So the intensity of transmission is different across the region, but because the definition of an outbreak is 1 confirmed case, so you hear that you have outbreak in all these countries, but it's really at different levels. And we are actively working with these countries to ensure that sufficient interventions are implemented to slow and halt and control this outbreak in the region.
Thank you, Patrick. The situation in Africa, as you mentioned, the spread to new countries which haven't had cases before was one of the factors behind why this was called a public health emergency of international concern. But of course, we have viewers, interested in many different countries. We're getting questions on what the picture is outside of Africa as well. So Maria, would you like to add a bit on what we're seeing outside of Africa?
To supplement, you mentioned this upsurge is one of the reasons the Director General declared a public health emergency of international concern. This is the second time that the Director General has done this for Mpox. This upsurge that Patrick described in the DRC, in Burundi, in additional countries, including countries that have never reported Mpox before, is concerning. The other reason this is concerning is we have a new clade. We have a new virus that is an offshoot of circulating Mpox viruses called this 1 clade B. And while we don't have the complete picture of the epidemiology, we know clade 1 is more severe than clade 2. But we're learning specifically about this clade 1B and need much more information about understanding the extent of infection, which is challenging because there is limited surveillance, although the at-risk countries, the affected countries, are working really hard to increase their surveillance and reporting. It's difficult to understand the full picture. So I just want to caveat here that what we are saying about Mpox, particularly with this upsurge, we're learning. And as we learn more, we will provide more information. And it's important to know this level of detail because this will guide the response. You mentioned outside of Africa. We still continue to see the circulation of Mpox reported from countries around the world, although the outbreak that happened in 2022, 2023 was largely brought under control. The numbers of reported Mpox cases are much lower than they were in 2022, 2023, that year of that Mpox outbreak. But it is still happening. So what we're asking for all of our member states is to make sure that they have strong surveillance. So this is important for many infectious diseases, Mpox included, that within that surveillance that they're doing some sequencing so that we can track this virus, we can do the risk assessments of the virus to understand if there's any changes, and also to, predominantly provide care to individuals, because it's about really making sure people understand what they can do to make sure that they can either prevent the spread or that they can seek treatment to make sure that they can minimize that severe disease coming from Mpox.
Thank you, Maria. We have a question from a viewer on where these viruses originate from. Maybe Patrick, you could address that. Do they come to us from animals, or where did Mpox come from?
Thank you. So the Mpox virus has been around for a very long time. It was identified in 1970, so it's been known for a very long time, and predominantly it was in the wild. So Mpox is a disease that we refer to as zoonotic. Zoonotic is that the virus originates from animal, and there's a spillover to humans. So when you see, for instance, like in DRC, we have 2 transmission patterns. You will have areas where we have had predominantly the zoonotic transmission, areas of the greater Equator province. You have people who come in contact with the infected animals or sick animals that die from this virus, and then they come and introduce this virus now in the household level. So you have amplification of transmission happening at the household level because of the contact that Maria was talking about. Because when a person is sick, there will be a lot of caregiving happening in the household, and then there are other close contacts in the household, so you have transmission. So initially, in this context, most of the initial transmission starts from that contact with an animal, and then it comes into the human population. But then we have also been having sustained human-to-human transmission, which has happened, like Maria described, from the global outbreak in 2022, which has been sustained then by the different forms of close contact that happen. So it is the mixture of these two that sustains this transmission, the initial spillover from the animals to the humans, and then the sustained human-to-human transmission through contact.
Thank you, Patrick. We're getting a few questions on how we prevent Mpox. And I know you've covered this. You mentioned that it's a disease that spreads with close contact. But maybe, Maria, could you say maybe some few actions, 3 actions people can do if they're in a community where there is Mpox around them? How can they protect themselves?
So the first part of that is exactly part of your question, is to know where Mpox is circulating. Sometimes that's difficult because we may not have the surveillance and the reporting that's happening out there. We do know that we are seeing an upsurge of Mpox in DRC. DRC is a very big country, and there's different transmission dynamics happening in different places. In the Kivus, we are seeing an increase in transmission. It's important to know as much as we can about how the virus is transmitting, whether we're seeing it in households, whether we're seeing it in sexual networks, because that will help in tailoring the response. And I think it is important to know that we are working with affected countries, we're working with local partners to make sure that the risk communication, the community engagement materials are specific and precise so that people can be informed to know what to do. I mean, the main thing is really to avoid close contact with somebody who has Mpox. Now, this can happen within families, people who have Mpox, especially if you have the lesions, to cover those lesions. Of course, people need to be taken care of if they have Mpox, but there's ways to prevent the transmission from one person to another, even if you have lesions, by covering them up. The other thing is that if someone has lesions, if they are symptomatic, to avoid having sex, because if we know that they're in the sexual networks, then that is one way. Sexual transmission is one way in which the Mpox virus is spread between people. So those are 2 different ways. But first and foremost is to really kind of understand the risk that is there. If you have Mpox yourself, avoid contact with others, and cover those lesions if you have, and to seek medical care.
Mm-hmm. Maria, when you say sexual networks, you're referring to potentially people who are having sex with multiple partners, right? Is that what you mean?
The 2022-2023 global outbreak, what we saw was this outbreak was largely in the communities of men having sex with men. And so in those, in that context, avoiding sex with someone who has lesions was really important, really helped curb the spread and bring that outbreak under control. There were other interventions that were used as well. It was incredible, the community that came together to stop that outbreak largely, even though there is some circulation. In the DRC, we've seen transmission among family members, in close contact within family members caring for one another. But we have some information from the field studies that are ongoing that the virus is in sexual networks. So in sex workers, for example. So people who are having sex with other individuals. So there's a combination of different ways in which this virus is transmitting.
Thank you, Maria. I think that's quite an important message around the fact that this virus is affecting many different groups, right? You mentioned sexual networks, but also in households, we're seeing children affected. So where the virus is spreading, kind of everybody is at risk. Let me ask Patrick, I'm not sure this has come in, but I know it's so important. Patrick, can you talk a bit about stigma around this disease? Because it's a physical disease, stigma plays a big role in whether people seek care. Could you talk to us a bit about how that's a factor in the Mpox response?
Yes, thank you very much. And I also want to start by emphasizing something about, transmission at the household level and the children that are affected. We are seeing also, like newly affected countries like Burundi, over 30% of the cases that have been reported in children under 5. And as you know, children under 5, they have higher risk of getting severe disease and death. So at the household level, it's very important for somebody, if it's an adult who has the disease, to really take measures to isolate themselves and prevent transmission to children who would be at high risk of developing complication. Now, the second issue, then, the question that you've raised, stigma is a very big factor that we need to address, because one, you see the disease itself, the way it presents in terms of the lesions, the rashes, the way they come on the face and all over somebody's body, it is something that is associated with stigma. People fear to come out in the public to be seen with those with the kinds of rash. That is the first thing. The second one, then, as Maria had mentioned, we have also seen transmissions that are linked to sexual network or sexual contact. So in the Kivu area, but also in the outbreak in South Africa, and this is also associated with stigma, because then people are not, particularly when they have multiple sex partners, they are not willing to disclose fully the interactions that happen, and therefore some of them we have seen in South Africa, transmission among men who have sex with men, and then they may be afraid to come forward to receive care for one reason or the other. So we've been encouraging that, one, in our messaging, we really should be clear that transmission of Mpox can happen to anybody and any person is at risk. And then number two is that also the person who has Mpox, really they need to receive care, so that, one, we prevent complication, but secondly also that we interrupt transmission from other people. So when the person is in a setting where they're able to receive optimum supportive care in an isolated setting in a clinical facility, then they can prevent transmission to others. And then thirdly, then is we know some of the people who have Mpox are also people with other medical conditions, and they need to get support for the other existing medical conditions. And this is critical so that we also prevent that. So all of us, we have a responsibility to work together to prevent stigma on Mpox, to spread the right message about the transmission and the risk, because there is the risk is everyone is at risk, and therefore we must all work together to prevent the disease.
Thank you, Patrick. So all our viewers can be involved in fighting the stigma and discrimination. In the end, we're all losers when there's stigma and discrimination that prevents people from getting the healthcare that they need. Maria, we're getting questions on whether this could become a pandemic. We've heard some people wondering, is this the new COVID? What do you have to say to that?
Well, that's actually one of the questions I get the most. Is this like COVID, or is this the same thing going to happen like we had with COVID? And it's not the same virus. It doesn't spread the same way. We're not seeing the same situation unfold. The points that Patrick just raised, those critical points that he made, anyone can get Mpox if you're in contact with an infected individual, but it doesn't mean everyone will get infected with Mpox. And I think that's an important distinction. What we saw with COVID and how efficiently COVID, the SARS-CoV-2 virus, transmits through the air with people, and how it spread around the world so fast. This is not what we're seeing with Mpox. There's so much that we can do with the right information, with interrupting transmission in different ways, whether it's making sure that within the families, like Patrick has said, to make sure that people are isolated and cared for, making sure that people receive care, making sure that we're working with communities, if this is in sexual networks or if it's in any community. There's a lot that we can do. So it's certainly not the same thing. This is not the new anything. This is Mpox. We have experience with Mpox. And right now, with the declaration of a public health emergency of international concern, there needs to be a concentrated effort, a global effort in solidarity to support the countries that are seeing this upsurge. While the whole world is paying attention and needs to be conducting surveillance and supporting people, we really need to concentrate our resources in the DRC and Burundi and neighboring countries that are at risk, because there's a lot that we can do. And as you have heard us say for COVID, we're all in this together and everyone has a role to play. So it's about having that right information, making sure that countries have the right resources with diagnostics, making sure that the therapeutics that are available are used for individuals. And importantly, when the vaccines are used, that they are used in a targeted way, focusing at-risk populations so that we can interrupt this transmission.
Thank you, Maria. The last point that you mentioned, vaccines, we're receiving a few questions on, and we know that's of interest to many people. Patrick, can you tell us a bit about, do we have vaccines, and the vaccines, what is WHO's advice around the use of vaccines?
Thank you very much. I think the issue of vaccine as a very important additional public health tool for control of Mpox has been, I think, of concern to everybody, particularly for us within our continent, because we have not deployed the vaccine so much in some of the areas where we would like to deploy. Now, WHO at the moment is working with the partners to be able to scale up access for countries within the region to the Mpox, to the vaccines that are currently recommended for Mpox. We have 2 vaccines that are currently recommended for Mpox. For some reason, in terms of production and capacity that is available for scaling up production, we do not have sufficient doses to be able to cover all the countries. And as Maria mentioned, the priority that was recommended by the SAGE is for us to have targeted vaccination in the high-risk settings for the high-risk groups. So people who are at risk of getting the transmission, some of the healthcare workers, people who have multiple partners, and the at-risk groups, particularly those for severe disease. Now, what we are doing currently, we are working with the countries within the region to develop the regulatory approvals necessary for the member states to be able to deploy this. We have worked with DRC, they have a plan, and there have been negotiations with the other member states that are willing to donate vaccines. We've gotten some commitment from the US government and the Japanese government to donate vaccines to DRC. We're quite hopeful that DRC will be able to start implementing additional rollout of vaccination soon, targeting the priority groups that I've talked about. Of course, previously there have been some studies ongoing on the use of vaccines. There have been some limited rollout of the vaccine in DRC and in Nigeria in the context of studies. But we hope that now, with the FAKE and with the ongoing efforts to have the vaccines under emergency use listing, we can be able to expand and target in the hotspots, particularly in DRC and Burundi, and have this implemented as an additional tool to target both in pre-exposure as well as post-exposure to Mpox.
Thank you, Patrick. We're running out of time, but just to highlight your last point, that it's the declaration of the public health emergency of international concern has brought a lot of momentum into this fight, these efforts to get vaccines, and that was one of the aims behind that declaration. We're out of time, so I'll just ask Dr. Maria Van Kerkhove, if you have any last, what is the one message everybody needs to know about Mpox?
Wow, one message. You always they try to get me to be as precise as possible. The message is that this is a virus that is out there. It is circulating, but there's a lot that we can do to prevent infection. This is not the same as COVID-19, and we really need to make sure that all of our efforts are focusing on the at-risk countries as well. If I may, Shagun, it's not part of that one message, but I did just want to highlight that. Supplementing what Patrick was saying about the vaccine, we at WHO are working with partners to develop a donation and allocation framework globally because there's so much attention that's happening on the vaccines in particular. Vaccines are only one intervention for Mpox. There are other interventions that need to be used, including public health and social measures, risk communication, community engagement, clinical care, etc. But on the donation side, what we want to ensure is that the doses that are available from the manufacturers, those that are donated from countries, go into this pot, if you will, and that the use is based on equity, it's based on need, and to design that so that we're not in the same situation that we were with COVID, and so that we make sure that those vaccines actually get to the people in need.
Thank you, Maria. WHO is working hard. My colleagues are here to prove it. I'll just for that one last message from Patrick. Anything that you want to leave the viewers with before we end this live?
Thank you. So I think the most important message is that it's possible to prevent and control Mpox, and we all have the responsibility to work together with the affected countries without isolating them, working with them in solidarity to provide the support that they need to be able to contain these outbreaks. We have done it before in 2022 when we had spread to other countries that had not been affected before, and we had rapid containment of this outbreak, and we know that we can do it this time around with global solidarity.
Thank you. I think the message to take away is solidarity, solidarity, solidarity. Thank you to our experts, and thank you to all of you who joined and asked your questions. I know the interest is more than we've been able to cover, so we hope to do these in the future again. Have a good day, everyone.
Thank you.
Thank you.